Hi. So this is my very first time doing something like this, but then this is my very first time having an issue like this. My name is Don, and I was diagnosed with prostate cancer 2 weeks ago. In the ensuing 14 days, I've spent an inordinate amount of time learning about this disease, which affects so many men, and especially African American men. And frankly, it was because of that research that I decided to do this. Because I hadn't seen videos of people that look like me with my problem. In fact, there really aren't a lot of patient videos, if you will, describing the journey through the discovery and then the transformation it has on one's life and then the cure. So this is my attempt to try to fill the void. Most people, when they're diagnosed with cancer, I think, have an immediate response. Oh my God, how could this happen to me? Oh my God, why me? In my case, I kind of knew it was coming, partly because of the journey that I'd been on to the diagnosis. And let me describe that a little bit. I hit a milestone birthday. I won't go into which one, but it was a big one. And I said, I'm going to do something about my health for the very first time. I'm going to get all the tests, do all the things that they say you're supposed to do. Had the colonoscopy, had the blood test, did the PSA, DRE, digital rectal exam, get my prostate checked. And a funny thing happened when the results came back from all of those tests. I was in fantastic shape. I'd never had an issue before physically. I was on all the different metrics, better than an athlete for a person of my advanced age. But one test came back negative with some suspicion, and it was my PSA. And the PSA was, at that point, a 7. And normal PSAs are either undetectable or 1 or 2 or 3. So I knew at that point that, wow, that's unusual. I didn't think too much of it because one of the other tests came back and said I had an enlarged prostate. And that enlarged prostates could be responsible for the higher PSAs. So I had another test done, and this time I wanted a 4K test just to make sure that, okay, corroborate that there really is something wrong with the prostate and it's not just, it's enlarged. And that test came back negative. I was sent to a urologist who looked at those results and said, you should have a biopsy. And I said, well, what's a biopsy? And so he began to explain to me what a biopsy was, and I said, I don't particularly like the idea of that. Let me do some research. And the more I researched the biopsy, which if you haven't had one yet, they take this wand-like instrument. It's called a ultrasound, TRUS, transrectal ultrasound. So they take this wand and they insert it in your rectum. And then out of the tip of the wand, there are little needles that penetrate into the prostate and take samples. Well, a lot of the research that I did online, on the internet, in books, basically said that that was kind of like shooting in the dark. And I didn't want that. It wasn't particularly painful, but it wasn't particularly pleasant either. And so my feeling was, if I have to do that, I want them to at least aim for something that's suspicious instead of just shooting in the dark. And so I told my urologist that before we do any biopsies, I wanted an MRI. And he gave me a lot of pushback about having an MRI, saying that, well, he didn't think the insurance company would do it. Most men don't go that route. You just should do the biopsy and be done with it. And I kept insisting that I wanted an MRI first. I wanted the most non-invasive form of detection first. Reluctantly, he sent the paperwork into the insurance company, and to his surprise, and frankly mine, they agreed to do the MRI. I did the MRI, and it indicated that there were 4 areas in my prostate that were particularly of interest. 4 small lesions, 4 small tumors that looked very suspicious. Also, by the time I was done with the MRI, I had another PSA done, and that had gone up. It was now an 8. So it was moving in the wrong direction, albeit not very fast. So I reluctantly felt I needed to do the biopsy. It was a good follow-up to the MRI. But I wasn't convinced that I had the right urologist. And so I made the decision to look for someone else. Someone who would work with me instead of fighting me. Someone who would listen carefully to me and who would be sensitive to my needs and my wants. Albeit medically approved, and it certainly, with good input and advice from him, but to at least be aware of what my concerns were and to respect them. I spent some time looking for a good urologist who kind of met those set of criteria, and I found a very good one. And we talked a lot about it. I showed him the MRI. He said that was probably the best thing I could have done, because now he knew exactly where he wanted to aim that transrectal ultrasound biopsy, a truss biopsy, with image guidance from the MRI, which is a little bit more state-of-the-art than just shooting in the dark. So we did the biopsy in the office, just leaning over the table and having him inserting this wand and having these 12 little thumps deep inside that were kind of not pleasant, but certainly not the horror story that I had read about, men complained about online. We successfully did those, and then afterwards, when the pathology reports came back, they were somewhat inconclusive, but they also indicated that there were some suspicious growths in the cells of some of the samples. My urologist was a little concerned because those sample cells, those results looked precancerous, he said, and he felt we would do another PSA, see if anything changed. By this time, it's like 9 months have passed since my first time around, and we would see what direction it would be, and if the PSA was still going up, we'd definitely get another but more invasive biopsy, something that would test a little bit more deeply if there were still problems that were associated with the PSA. We did the PSA, came back, and it was even higher. It was a 10. So it was definitely in the wrong direction. It had moved 3 basis points or 3 points in the course of a year, and he was concerned, and we did the second biopsy. This time under anesthesia, because he was going to be definitely, as he said, digging in there to make sure that he got the samples that he needed so he could give a better prognosis of what was going on. Those results came back and indeed showed that out of the 24 samples that were taken, 5 of them were positive for cancer. The highest was 20% of the cells, and that was in one of the samples. 2 of the samples had 10% of the cells showing cancer, and 2 showed only 5% of the cells of the sample showing cancer. The other good news from that more invasive biopsy was that the cancer hadn't spread. It was localized to the prostate, didn't involve any other areas that he could see through the ultrasound. It was also confirming what the MRI had shown. So at that point, we had a positive diagnosis that I have prostate cancer. It was very early. My Gleason score, new language now, the Gleason score was a 6. So I had a 3 and a 3, which meant it was very early in the process, very early in staging. The bad part about it is that the cancer was in both lobes of the prostate. So that made me a low intermediate stage cancer, or having a low intermediate stage cancer. So what to do? What to do? There were 3 things that were suggested by my urologist. Active surveillance, where they monitor you over a period of 3 and 6, every 3 months or so, just to take PSAs, perhaps do more biopsies, certainly additional MRIs, to see if the cancer is getting progressively larger. I wasn't particularly keen on that idea, since I'd already had it, in the course of that year, seeing my PSA going up by 3 points. My urologist agreed that probably wasn't a good idea in my case, because at some point, maybe 3 months, 6 months, but certainly within a year, I would be hitting levels where active surveillance wouldn't necessarily be a good course of action. Second option was to do a radical prostatectomy, albeit with state-of-the-art surgical technique, the Da Vinci method, the robot, but just to remove the prostate and take the cancer out. The third option was to do radiation, and the radiation had 2 variants: external beam radiation or seeds, brachytherapy. So my oncologist, or my urologist, suggested that I get some more opinions, talk to some a medical oncologist, radiation oncologist, do some research, and we would meet again in 2 weeks, and I would let him know what my decision was going to be and how we were going to move forward, and how we were going to treat this thing. I started my research. Well, I've never enjoyed the prospect of anything that would go inside the body, open you up, cut things out. I'm proud to say that in the time I've been on this earth, I've not had any need for any kind of surgery for anything. I've been very healthy. I've been very an outdoors person. I didn't have I still have my tonsils. I still have my appendix. I've not experienced any broken legs or limbs. There was nothing in my history up to this point that had ever involved being in a hospital for any appreciable length of time. In fact, the very first time really was for the colonoscopy, and that was just a matter of hours. When I had the second biopsy, and even though I had undergone for the second time in my life to be under anesthesia, that was only for a few hours. So the idea that I would be 2 or 3 days in a hospital, that I would have incisions made in my lower abdomen, that I would have to basically be bedridden, or at least at home for at least a week to 2 weeks while the incisions healed, that I would be having a catheter in my penis for a week, that I could experience urinary leakage for the rest of my life, that erectile dysfunction was a very strong possibility. Surgery was like the thing I wanted to avoid at all costs. So then I started really researching the difference between surgery and radiation. My urologist, a surgeon, cautioned against the different horrors that could take place with radiation therapy. You'd have burns on the rectum that would be permanent, that the radiation would cause secondary cancers, that you'd have the possibility of erectile dysfunction as they would burn the nerve bundles on either side of the prostate that would control erections. That you'd have urinary issues because the bladder, being so close to the prostate, would get burned by the radiation. That these are very serious and lifelong effects, and that because of the nature of the radiation, you could not do surgery afterwards. That something called salvage surgery was very difficult, and it was almost cautioned against. And that if you did surgery first and had a recurrence of cancer, that you could then do radiation, but you couldn't do radiation first and then surgery. So it was a horrifying prospect. But I was convinced I didn't want to deal with the after effects of surgery. I saw some great videos. There are a few out there of people who shared their experiences undergoing the radical prostatectomy and dealing with the surgical after effects. And in looking at some of those videos, I said, I do not want to be those guys. So I spent a lot of time looking at radiation therapy, talking with the radiation oncologists, getting familiarized with what it all entailed. And then I found, and I made my decision actually, I made my decision that, okay, the state-of-the-art in radiation had progressed to the point where their cure rates were equal to surgery, that the after effects were minimized as compared to the known surgical problems, that a lot of the early radiation issues have been dealt with in changes in technique, and that there were a lot of new radiation therapies and state-of-the-art radiation modalities that really minimized considerably a lot of the erectile dysfunction, the bladder issues, the rectal burns, and still cured the cancer. And so with that feeling that, okay, I could make this decision and it would be a good decision for me, I was all set to go and talk to my urologist and tell him, disappoint him, that I would not be going the surgical route. And then I found a video from the Prostate Cancer Research Institute, just the day before I went to talk to my urologist. And that video had been released just a couple months before all of this took place. And in that video, the head of the Prostate Cancer Research Institute compared surgery and radiation and basically came to the conclusion, he's a medical oncologist, doesn't have a horse in either camp, surgery or radiation, but looking at it objectively said, you know what? In the modern era, which we're in, radiation is superior to surgery. So for me, that was confirmation that I was making the right choice, that given everything that I had read, given everything that was known in the field, that today surgery is not necessarily the first go-to, that radiation can be very effective, and particularly for someone with localized prostate cancer like myself, where it's still within the confines of the prostate, and with such low Gleason scores and with relatively low levels of cancer. And so I told my urologist, I made the decision, I made an appointment later that week to meet with my new friend, my radiation oncologist. And in between, I was still looking for articles, still to make sure that I was making the right choice. And then I found a very interesting set of papers that had been presented a year ago at a meeting of urologists, where an African American doctor, a woman who had been looking at the literature and looking at the studies that had been done, was making the argument that African American men seem to do better with radiation than their Caucasian counterparts. And that was intriguing to me. So I followed more research, trying to find more, and I actually found several videos that corroborated that, and that basically postulated, they don't know why, but it seems to be that African American men have a better response to radiation treatment for prostate cancer than their white counterparts. So, taking one for the team, I want to continue to prove that that is in fact the case. And so I met with my radiation oncologist and told him that we're going to full speed ahead on radiation. We're doing external beam radiation that is image guided, where they do CT scans before and x-rays before each treatment, and that they're able to, it's called volume modulated, so they're able to shape the beam so that it is very precise in hitting exactly where they need to hit in order to kill the cancer. And this is the other interesting thing about radiation. I'm going to do 5.5 weeks of high dose radiation therapy. It will disrupt the DNA of the cancer cells, preventing them from replicating, and in effect kill them. And after the 5.5 weeks, if all goes well, the cancer cells will die, as will the prostate. And at that point, as I heal, there will be this inert mass, hopefully dead, within me. So I'm still not really wrapping my mind around how I'm going to deal with that or what that's going to be like, but I'm assured that the cancer will be extinguished through this process, and I should recover and be cancer-free successfully. We won't know for sure because it takes a while for the prostate to die. We'll be monitoring the PSAs after the treatment for the first year. And as I go through that process, I'll do more videos where we'll try to hopefully report successfully that my PSA is going down. Though I've just cautioned that sometimes you don't see an immediate decrease in the PSA because it does take a while for the cells in the cancer to die and for the prostate to cease function. And that there could actually be sometimes a bounce where the PSA goes up. Not to be worried. We keep monitoring, and hopefully we'll see it start to go down again. But after a year or so, the expectation is that the PSA will be in a normalized range, if not undetectable. So we'll see what happens. Fingers crossed. In the meantime, radiation therapy. What is it? I went for my for my test, my CAT scan, so they could take images of the prostate, make their marks, so that they know where to align the actual radiation beams. It was painless, absolutely painless. I felt nothing except for little pinpricks where they did the permanent tattoo, little tiny mark that looks like a freckle on my abdomen and the side of my pelvis. But the beams, the CAT scan, it didn't really do anything to me, and I'm assured that when the actual radiation treatment is done, it'll be similar. There's some relatively minor preparation in order to minimize the damage to the rectum and the bladder. The new protocols, if you're not using the space ore, which is a gel designed to create a space between the organs at risk, OAR, which are the bladder and the rectum, you can achieve something similar by emptying your rectum or emptying your bowels before you go in for the treatment, and having a full bladder. Those two things move those organs away from the prostate in a fashion that allows them then to go in with the beams and minimize the spread beyond the organ. I'm also, it's important to know that the radiation therapy, they can pinpoint where they're sending these beams between 1 and 2 millimeters. So they can get the surface of the prostate, the capsule, in addition to everything that's inside of it, and do it very delicately in a vessel-sparing way, because the nerve bundles that control erections and ejaculations are on the sides of the prostate. I'm kind of marveling at that, and I can't wait to see how that works. But because of that precision, if you have a full bladder and an empty rectum, you should be able to get through the 15 minutes on the table without any undue injury to the organs at risk. So this is the beginning of the journey. I've just been simulated and now measured, and soon in the next week we'll have our first week of treatment. We'll do 5 days, and then we'll meet with the radiation oncologist to see how we did, and we'll repeat that protocol every week for the next 5.5 weeks. So with that, wish me well. I'm expecting this to be a successful journey, and I'm hoping that if you're out there listening to this and you find yourself now having to deal with all things prostate cancer, that you'll be able to learn something from my journey that will help you in yours. Thanks.